We are following a nationwide health warning about the Zika virus. The Food and Drug Administration is making a new move to protect America's blood supply. It's asking all blood banks to start screening for the mosquito-borne disease. The warning applies to the states and all U.S. territories. The requirement was previously in effect only for areas active with Zika transmission, like 2 counties in Florida and also Puerto Rico. Blood banks already test donations for HIV, hepatitis, West Nile, and other blood-borne viruses. So our chief health editor, Dr. Partha Nandi, is here now. And Doc, a serious change in policy here as we're hearing about more reports of Zika infections. Can it spread through blood transfusions?
It's a great question. So it's like, can I get Zika through blood transfusion? Now, we don't know a lot about, how Zika can be transmitted, but there's a strong possibility that the virus can be spread through blood transfusions. And there's already been reports in Brazil of Zika transmission through blood transfusion. So it can happen because most people with the virus don't have any signs or symptoms, so have no idea they've been infected when they're donating the blood.
So, Dr. Nandi, is our blood supply safe? I mean, especially for people living or traveling to Florida?
Another great question, Glenn. And so the risk for you and I is really low, but the FDA is recommending testing the entire blood supply to make sure the blood is even safer for those who might need a transfusion. Now, testing for Zika in donated blood is already happening in Florida and Puerto Rico and has been effective in identifying the donations infected with Zika virus. Now, they'll expand this testing and it'll stay in effect until the risk of the Zika virus via transfusion, that transmission is reduced.
All right, Doc. Thank you.
Welcome.